Dear colleagues, I'm very happy to finally be able to make a presentation on Dental XP, and I'm very thankful for the invitation. And today we're going to talk about zero bone loss concepts, the influence of vertical soft tissue thickness on crestal bone stability. But before we start, let me introduce myself. I am Tomas Linkevičius. I am coming from Vilnius, Lithuania, and currently I'm serving as an associate professor in Vilnius University. Also, I work in a private dental practice in Vilnius Implantology Center and as a director of research center in Vilnius Research Group. So, zero bone loss concept, what is that? Basically, it's a set of various factors which, according to our clinical experience, have some sort of influence on crestal bone stability. For example, the depth of implant placement, or from prosthetic point of view, screw retained or cement retained. These factors have influence of how bone is stable around our implants. And based on these factors, we have developed a series of lectures, and we could divide them into two groups, into development of crestal bone stability and into maintaining this stability, because one thing is to develop, but more important is to preserve the stability. And today we really will start with the first lecture, the influence of vertical soft tissue thickness on crestal bone stability. And here we're going to talk about soft tissues, implant placement, and implant design. But let me start with this picture, because I always start my lectures with this picture. And I always say that this is the dream of every dentist. Let's be frank, doesn't matter what kind of implant system are you using or what kind of surgery you're doing. This is the X-rays we would like that to have all of us. And when I show these X-rays to the doctors, usually two questions arise: what kind of implant it is, and what kind of doctor made this treatment. And the reason is that really these X-rays speak for themselves. When you show such kind of X-ray with such stable bone, there is no question that the treatment is successful. Well, why crestal bone stability is important? Well, three major things: cortical bone for short implants, and also from aesthetical point of view. When we talk about cortical bone, we know that the cortical bone is much stiffer and much more stronger compared to cancellous bone. But during crestal bone resorption, we are losing this cortical bone, and sometimes this procedure may go on, and we may lose bone even further apically. So yeah, this crestal bone loss is dangerous because we never know, will it stop or will it continue like in this clinical case. Aesthetics. Of course, aesthetics is also a key factor, and crestal bone stability has a major role here. But I think not in terms of papilla maintenance, because we all know that papillas are maintained by neighboring teeth, but in most of the vestibular aspects. So when we lose bone, we actually have vestibular collapse, the tissues shrink, and sometimes you can see the situations like here. You can see the shining through of the implant itself. But the most important application is of crestal bone stability is in short implants, I think. And the reason is very simple, that when you have a longer implant, you can at least afford some bone remodeling. 2 millimeters for, let's say, 12 millimeter long implant is one thing. But for example, if you have 6 millimeters implant or 4 millimeters implant, so losing of 2 millimeters may be fatal. Like in this case, after losing the bone, actually implant is broken out of the bony housing, and we lose not only implant but prosthesis itself. And there is another factor which is more related to us as the clinicians. Just think what kind of treatment you would like to give to a patient, like this or like this, when you can see bone resorption. And if you would would be challenged with a question in which side you would like yourself and your patients would be, I'm sure that everybody would choose the left side. So yeah, crestal bone stability is very important. What about crestal bone loss? Well, when you look at these pictures, this is the picture, probably the first picture of crestal bone loss. It's been in 1977. And look, this is what we have now. So just think about it. It's 40 years of constant innovation. Implants have changed dramatically. New surfaces, new materials. Our prosthetics also changed dramatically compared to 14 years ago. But look, actually we still have crestal bone loss. We're still losing the bone, and this problem actually is not solved even after 40 years of innovations. And this problem was so common that indeed also now it's been considered as a normal thing to lose about 2 millimeters or 1.5 millimeters of bone loss after first year of function. And this is considered as a success. But we think that it's not success. We should do much more better than this. Well, of course, there is a myriad, really many factors which influence crestal bone loss around implants. But we are not going to talk about all of them, because majority of them are operator-dependent crestal bone loss. What I mean? I mean that if you do something wrong with your hands, for example, like here, when you have bad 3D position, when implant angulation is bad, doesn't matter what kind of implant you are using, you will have bone loss and you have recession of soft tissues. So these are things which are operator dependent. But sometimes you have done everything 100% correct. I mean, you have attached tissues, you positioned implant properly, the implant is okay, everything is fine, but you still lose bone. And just imagine that you start your follow-up with an X-ray like this. So I would like to be a patient or a doctor in this case, because you can see that you have already bone loss and it's just after delivery of the crown. So we will talk about what causes bone loss in these situations. Well, in my opinion, there are three most important factors to situations which I described: polished implant neck, absence or presence of microgap, and soft tissue thickness. Well, what about polished neck? Well, polished neck was designed many years ago, and it was designed in the way of thinking that if you will lose bone, a part of the implant will be exposed, but the polished part will be exposed, and you will have less plaque or bacteria accumulation. But the problem is that the doctor started to place polished neck implants below the bone. And it's really now proven that if you place the implant with polished collar equally with bone or a little bit deeper, you will lose bone to the margin of the polished collar. And there are many studies who prove that. Another factor, microgap. When you look about the microgap, I think this is the most researched factor which influences crestal bone instability. There are so many studies, and all of them say that if you have microgap at the bone level, you will lose the bone. So what did manufacturers do? So they, of course, react to the research, and they started to produce roughened implants with roughened neck without polished collar. And for example, if you are using a traditional connection implant, they started to recommend to place implant supracrestally, in that way avoiding the positioning of bacteria inside microgap to the near place of crestal bone. Well, but we're still losing bone. Even though we are using these recommendations, we are still losing bone. And the reason is that we did not think about soft tissue thickness. So what is soft tissue thickness? Well, let's in the beginning decide that we are talking about vertical or crestal soft tissue thickness, which is measured at the top of the crest. And vertical soft tissue thickness is not biotype, when you can say it is a thin or thick biotype. Well, it's not horizontal thickness when you can measure it with a probe. And it's even not attached tissues, like in this picture you can see that we have attached tissues, but they are thin. So this is a completely new and separate parameter, and it must be measured vertically at the top of the crest of our edentulous ridge. Well, so why this crestal or vertical soft tissue thickness is important? Well, it is important because it is part of biological width around implants. I should say more precisely not the part, but from this vertical soft tissue, the biological width around implants is formed. It's sulcal epithelium, junctional epithelium, and connective tissue. And when you have a healed implant, which is completely integrated, there is soft tissue thickness is a barrier. It's protecting our osteointegration. So this is why our soft tissue thickness is so important. And well, God made us in that way that we have different scenarios. We have patients with thin vertical soft tissues, and we have patients with thick vertical soft tissue. And what I learned during the years that in different countries there are different biotypes. For example, in my country, Lithuania, the prevalent biotype is thin, that we have thin vertical tissues. However, for example, when sometimes we have patients from southern Europe, from Spain or Italy, we usually have thick vertical soft tissue thickness. So it's according there, it's very, very different. Well, and when people, because I've been lecturing with this topic for quite a while, say, well, you did something interesting, this is what was known before, I always start my lectures with quoting of this paper of Berlund and Linde, Dimensions of Peri-implant Mucosa, Biological Width Revisited, because they were the first to identify the influence of vertical soft tissue thickness on crestal bone resorption. And they did a really simple and nice experiment. They took dogs. In one case, they had thick vertical soft tissues, 4 millimeters, and around other implants, they just cut the half of the tissues, thinned them to about 2 millimeters, and then everything was sutured. And after healing, they found out that in test implants, which were positioned in thin biotype, they had significantly more crestal bone loss compared to control implants, which were in thin tissues. Well, but what is the problem with this study? Because it's a